Welcome to one of these sessions with the Science and Technology Summit for Ascend for the August session of the Ascend webinars. My name is Dr. Shauna Pandya. I am a Canadian physician and scientist astronaut candidate with Project Possum and the International Institute of Astronautical Sciences. So to start, a question: what do the International Space Station submarines, Arctic and rural villages, and stations in the middle of nowhere, as well as the International Space Station, all have in common? These are all examples of resource-limited and remote communities, and the technologies we need to deliver healthcare in them need to be managed and devised accordingly. So today we are talking from orbit to OR, space medicine lessons and technologies for Earth. We're talking all about spin-in and spin-off technologies, which I'll explain in just a moment. And we have a rockstar panel representing perspectives from industry, academia, regulatory and funding side, as well as from in the field, to talk about the lessons learned, the challenges, the pitfalls, and the pearls, as well as the future of spin-in, spin-off technologies. So today with us, I'll introduce them in detail a little bit more as we go through opening statements, but we have Dr. Einar Sawyer, Chief Health Innovation Officer at TRISH, or the Baylor College of Medicine, NASA-funded Translational Research Institute for Space Health. We have Dr. Mike Wesolowski, Chief Executive Officer of Luxonic Technologies, and a side note, he's also one of my bosses, so be extra nice to him. Dr. Kat Jameson, Professor of Medicine at the University of California, San Diego in hematology. And last but certainly not least, Ms. Yvette Gonzalez, Director of Business Development and Outreach at the International Institute of Astronautical Sciences, as well as a disaster resilience expert. So before we proceed to our opening statements, let's just kind of set the definitions of what we're talking about today. So when we talk about spin-in, spin-off technologies, you know, we hear a lot about what has space done for me lately. And actually, when we talk about spin-off technologies, we talk about technologies that have been developed for space that have actually been adapted for various uses on Earth. That's what we mean by spin-off technologies. And when we talk about spin-in technologies, we refer to Earth technologies that have been adapted for space. With that said, I am going to go through each one of our fabulous panelists. I'll introduce them briefly, and then I'll allow them to start with an opening statement to tell us more about themselves, their journey into this world of spin-in, spin-off technologies, what they currently focus on, and how they got there. And then we'll open it up to the panel for discussion. As a side note, Dr. Jameson does have a hard stop at 1/2 the hour, so we will try to cram in as much of her brains and experience as we can early on. Without further ado, I'd like to turn it over to Dr. Einar Sawyer. As I said, she is Chief Health Innovation Officer of the Translational Research Institute for Space Health, or TRISH. She has over 2 decades of experience in health tech innovation, remote medical management. Her resume is super long, but I'll give you the highlights. She is an orthopedic surgeon at UCSF, Director of Skeletal Health Services, and the Director of UC Space Health, as well as the co-founder and co-director of the UCSF Center for Advanced 3D Technologies, co-founder for the Center of Digital Health Innovation, as well as a board member for the UCSF Health Hub. Last but not least, she serves as the expedition medic and medical advisor for extreme ocean rowers. I could go on, but I would rather give Dr. Sawyer all the time she needs to tell us about her journey in the spin-off, spin-in. Over to you.
Thank you so much for that, Donna. I really, I feel honored and privileged to be in the conversation with my esteemed panelists and with you, and also in conversation with the audience, I hope. So I'm an orthopedist at UCSF, and I run the bone health service here, the skeletal health service. I started as a physical therapist, and then after a decade of that, became an exercise physiologist and eventually an orthopedic surgeon, and am now working in space health. But along the way, the continuing themes are that I was always trying to help enable people around self-health and medical management, so to take care of themselves. And as more technologies became available to make that possible, I would incorporate them and loop them into the work that I was doing towards that end. So I have a couple of decades of health tech background, and as Shauna mentioned, I cover ocean rowers. We've got one at sea right now that is getting close to Hawaii from a row starting in California. So if you want to send Leah Ditton some good wishes, I'm sure she'd appreciate it. It's a long journey as a solo ocean rower. I've always been involved in remote medical management, as I mentioned earlier, trying to empower individuals. So I use it in my clinical practice as well. And I think the opportunities we have now to shift our focus more and more to distributed but not diluted healthcare, I think it's just imperative for us to embrace those opportunities that we've seen come to light in COVID, and then somehow work towards making them standard of care, not just bolt on nice to haves to the centered healthcare practices that we have at this time. I was very fortunate a couple of years ago to be asked if I would consider a position as the Chief Health Innovation Officer for TRISH. And TRISH is an innovation arm out of NASA, and it's funded and funded by NASA Human Research Program at Johnson, and it's based at Baylor with collaborative and cooperative agreements with MIT and Caltech, and then the UC system has been introduced through my role. And what we do really in my job is quite fun. I get to understand deeply the risk to humans in space, and particularly our charge is deep space, so missions to Mars and looking way ahead as to how we're going to manage those challenges. And then after getting an understanding of that and continuing to evolve that understanding, my job is to source innovative solutions. So I'm constantly landscaping, constantly looking for space relevant and space adaptable and space feasible technologies, even if they weren't originally designed for that environment. Because ultimately our goal is to provide the astronauts and the crew supporting them the ability to have independent capabilities around understanding their conditions minute to minute if necessary, and then reacting to them in an intelligent way that will keep them from deteriorating down clinical pathways or declining performance while they're there. I think it's really fortunate that I'm in this role, and what it also affords me is not just improving safety and medical management for human space exploration, but then the terrific ability to transfer that knowledge back to Earth. So I call ocean rowing the edge case for remote medicine. And that was before I got involved in space medicine. So if you want to compare physical distancing, as we know it today, remote ocean rowing is beyond that, but space is really the ultimate case. And it's a forcing function for many of the problems we're trying to solve on Earth. So I look now at space as an analog for Earth, rather than constantly looking at Earth analogs for space.
Very well said, and I already have so many questions brewing that I want to ask you and the rest of the panel. But before we do that, I am going to turn it over to Dr. Mike Wesolowski, Chief Executive Officer of Luxonic Technology. He is the co-founder and CEO of this company, which develops immersive software for improving global access to hands-on medical education, professional training, and healthcare delivery. Mike is an avid proponent of immersive technologies like virtual and augmented reality, and he champions immersive tech as a speaker at international conferences and events, serving on several committees with the VR/AR Association, and is part of the newly formed FDA collaborative community on medical extended reality. He also has a PhD in physics, and without further ado, I am going to turn it over to Mike to tell us more about his journey into tech development and how it may apply for space and for Earth. Mike, over to you.
Thanks, Shauna, and thank you so much for the invitation to be here today. I'm honored to be on this panel. I think my bio is probably going to be the shortest and least impressive of all the panelists. It's amazing to be here. So I come from an academic background. As Shauna mentioned, I have a PhD in physics from the University of Waterloo. From there, I went on to do a postdoc in medical imaging at the University of Saskatchewan, and am currently an adjunct professor in medical imaging. So throughout my academic career, I've been fairly multidisciplinary. I've worked in fields ranging from solar astrophysics all the way through to nanotechnology, to medical imaging. So for example, in medical imaging, I've worked on the development of X-ray phase contrast technologies, which allow us to use traditional sort of X-ray to see soft tissues. We were applying that work in the detection of prostate cancer. I've also worked in the development of new pharmacokinetic models for nuclear medicine. You know, throughout my academic career, really, I've had a focus on innovation and integration of new technologies. And really, for the past several years, the focus has been in medicine and medical imaging. But my day job right now, and for the past 3 or 4 years, has been building a company. We started the company with the idea, Luxonic, with the idea of really providing access to healthcare and greater access to healthcare around the world. And one of these new technologies that's been in development actually for the past, well, almost 60 years, but really has hit commercial success in the last several years since 2016 is virtual reality. And what virtual reality allows us to do is really put people into different environments and allow them to experience environments. So using a headset like this, we can trick the senses into thinking that we're somewhere else and we're experiencing things that we wouldn't normally experience. And for medicine, this is really powerful because what it allows us to do is put people into clinical scenarios that they can experience hands-on and really interact with those scenarios in a very similar way to the way they do in real life. And so that's been our focus at Luxonic. We're developing immersive technologies to improve medical education, hands-on professional training and assessment, and then even into the healthcare delivery side of things. So one of our products, for example, Sievert, is a full radiology reading room in a virtual headset. So a radiologist's workflow really starts, you know, when the patient gets a scan. That scan is then transferred to a radiologist, and radiologists basically spend their entire day reviewing medical images. And so what we're able to do is we're able to virtualize that entire environment and then put it into a very compact package. And sorry, we're getting an emergency alert here. Just 1 second.
Is the building on fire? Are you okay?
No, that was a provincial alert. Unfortunately, there's a little girl who's gone missing. Wow, okay. So, you know, what we have been doing in terms of spin-in technologies for space, basically in 2018, the Canadian Space Agency put out a call for Canadian healthcare technologies for deep space missions. So the idea is, as we are going further and further away from Earth, we are going to need more and more autonomous healthcare, and I'm sure the panelists will talk about that a little bit more later on. And you know, part of that autonomous healthcare includes training and upkeep of clinical skills, as well as providing procedural guidance in the case of an emergency. So that's really how we became involved with the space technology. We developed a concept for the Canadian Space Agency to provide that type of autonomous training and procedural guidance. And so we're working on that currently as one of our projects, and it's actually going to be a product called Caregiver, which should be released sometime next year. And that's where I will stop.
Thank you so much for that, Mike. So next, I'd like to turn it over to Dr. Katrina Jameson, Professor of Medicine at the University of California, San Diego. Her resume is equally impressive, and she is a leading physician, scientist, and pioneer who has discovered missplicing, RNA hyperediting, and splice isoform switching on mechanisms governing human cancer stem cell maintenance in selective nations. This pioneering stem cell research has transformed therapies, including JAK2 and sonic hedgehog inhibitor trials for myeloproliferative neoplasm and leukemia stem cell targeting. That's a lot of syllables. So rather than try to explain it myself, I will let Dr. Jameson decipher what that means and its relevance for space and for Earth for all of us.
Thanks so much, Shauna. It was really exhilarating to hear the backgrounds and the interest of both Mike and Einor, and I know we're going to hear a lot from Yvette as well. But, you know, I think that we're at a nexus now where we need to decide how we're going to use space to solve some problems on Earth. And I know that, you know, these deep space missions that Einor will be helping with are going to be tremendously important for humanity in terms of understanding how we can expand our horizons, literally and figuratively. I think on Earth we have some really important bottlenecks for healthcare, as Mike was alluding to. We have to train physicians. We have to also consider getting retrained ourselves and thinking about how do we provide the best healthcare. And, you know, in terms of the COVID crisis at the moment, we thought that this would end. I pontificated to a patient in my clinic, which I'll start again at 8:30 or Pacific time today, that this will be over in June because it's a virus. Coronavirus is a virus that likes the cold. Well, I was completely wrong. And so I think that we need to find better solutions to problems on Earth. And I think that 250 miles above us on the International Space Station, we may be able to understand stem cell dynamics, how the immune system is regulated, and how it's dysregulated, and how stem cell biology is dysregulated. So I'm a hematologist. I'm also a regenerative medicine specialist. And in my clinic and also in my lab, I study benign and malignant stem cell aging in the hematopoietic system. So the blood forming system can develop mutations at the level of the blood forming, or in other words, hematopoietic stem cell, that can lead to leukemia. And when you look at the twin study that was published in Science, there were some pre-leukemic changes there in the blood of Scott Kelly with telomere lengthening that may not have gone completely back to normal. So telomeres are maintained by an enzyme called telomerase, discovered by Elizabeth Blackburn, who won the Nobel Prize for that. She was at UCSF at the time, and you know, at the time a lot of us didn't understand how important that was for stem cell longevity and also for cancer. And now what we understand is if you activate the enzyme telomerase too much, you actually can trigger the earliest stages of cancer. So in other words, in low Earth orbit, LEO as it's affectionately called, I think that we can understand some aspects of aging in a compressed time frame because of increased exposure to ionizing radiation on the ISS, in addition to some inflammatory stimulants that lead to immune dysregulation and viral reactivation. So we've just got a task order from NASA. We're collaborating with NASA and Space Tango to build an integrated space stem cell orbital research lab, iScore. And so we hope that we all score by having this collaboration on the International Space Station, working with national labs to really understand how stem cells divide and differentiate in space. So we have 3 projects. One is the Brain Organoid Project run by Alison Motry and Eric Vera. The second is the Liver Organoid Project run by David Brenner, our Vice Chancellor, and Tatiana Kiselva, who's a scientist working on fatty liver. And then Sheldon Morris and I have the immune dysfunction and hematopoietic stem cell aging and expansion part of the grant. So we're really excited to work with Space Tango on this together with NASA. And that's it for me.
That's amazing. And I already have so many questions. But before we get to the discussion, last but certainly not least, I'm delighted to introduce Ms. Yvette Gonzalez with a Master's in Public Health. She's the Director and Business Development and Outreach Business Development and Outreach of Project Possum and the International Institute for Astronautical Sciences. Very relevant to this conversation, she's a human resilience and human factors expert with 22 years of international development, humanitarian, and emergency response experience, including rebuilding communities in active war, conflict, natural disaster, and epidemiological outbreaks. She currently focuses on space science and policy. She has a lot of experience deploying novel technologies in these environments. And she is a member of numerous groups, including AIAA, as mentioned, the International Astronautical Federation, the Women of Aeronautics and Astronautics, Association of Spaceflight Professionals, and the American Institute of Aeronautics and Astronautics. There's a lot more, but I will leave it to Yvette to tell us more about her extensive experiences and how they tie into the current conversation. Yvette, over to you.
Thank you so much. And I wanted to thank the Ascend Summit for also hosting a relevant conversation and dialogue, because I think it's very important, especially now. And I'm very honored to be amongst this panel. So my background, those 22 years haven't ended. I'm still a humanitarian. And so I'm in a unique position right now where I bridge the humanitarian work that I continue to do, the international development work, and my space science. And in that, I have spent the last 2 decades, different pockets, I would say, of very complex contexts around the world where we are facing the divide of human behavior, and being able to look at how do we overcome adversity of all those levels that Shauna mentioned, epidemiological, traumatic events past kinetic war zone, within an active conflict, and definitely natural disasters, and what kind of mechanisms help a community to face open disease, to face open lack of either economic or even their livelihood structures, and definitely policy structure. But within that, I found probably the last decade working in Africa, Latin America, and Asia, and mostly Africa because I work a lot of Francophone countries. How do we advance with technologies that are really rapidly growing in the industries that we need to apply? Agriculture, health, medicine, in contexts where the fundamental needs for those technologies don't exist. Power, Wi-Fi, access to satellite data. A lot of that still wasn't bridged when I began a few decades ago working in these contexts. And now I'm really excited to work with some of these groups to be able to bridge access to those. And it doesn't happen 100% of the time, but just being able to provide the information and connect different emerging space nations with the relevant technology and finding solutions. The scope of my work has gone from pure epidemiologist and going in and kind of being the epi detective, finding out how do we find solutions that are local. Now it's, let me introduce a technology that might work, it's worked in other countries, and how do we gain access to it? So it's become, how do we make that a socioeconomic portal for a lot of these communities? When you look at space, it's the same approach. How do we make a very remote environment accessible to the technology? So is what we're hearing. So I'm excited to contribute a lot of how I've deployed science both into the humanitarian context and into space on the ISS.
Thanks so much, Yvette. And I definitely want to get into the realities and the pearls and pitfalls when it comes to tech deployment and, you know, not falling into the one size fits all mindset. One thing I'll get you to do, Yvette, if you're able, is just to turn up your mic just a touch. You're about 15% too quiet. And then I want to get into the first question for our panel. So I just want to give our audience a broad overview of what the spaceflight environment is like. So to start with, I'm going to turn it over to Kat and Einor to specifically kind of lay out the challenges of long duration human spaceflight and how that might open up opportunities for technology development, specifically medicine, but maybe in other areas. So maybe Kat, will specifically start with you speaking to the immunological changes and virulence that you alluded to in your opening, and then maybe turn it over to Einor to talk about other physiological changes such as bone health.
Yeah, thanks so much, John. I really appreciate this opportunity to try and tackle this very challenging question. I think when you look at long-term spaceflight, just based on Scott Kelly and the kinds of changes that he had published in the twin study in Science, it was quite clear that he had some pre-leukemic changes in the blood and also evidence of inflammatory growth factor activation, which suggested that he'd been exposed over that almost 1 year period to, you know, an inflammatory environment but also agents like, or exposures like ionizing radiation, they would accelerate DNA damage and potentially activate some enzymes that are meant to keep our DNA and RNA intact. Those enzymes, when activated for too long, will actually introduce mutations in our DNA and RNA. And so I think one of the challenges to long-term spaceflight is potentially accelerated stem cell aging. So, you know, Einar and other orthopedic surgeons are, you know, really at the forefront showing that bone density can change if you don't do 2 hours of weight-bearing exercise on the ISS. And, you know, they spend a lot of time weightlifting. But it's not clear that that will build the bone, the intramedullary cavity bone where we make our bone marrow stem cells. And so there could be a problem where our bone marrow stem cells age too quickly and the immune system doesn't manage to regenerate itself properly. So why would that be a problem? So I'll start clinic in a few minutes. And it's all to do with people who have bone marrow failure syndromes, who have had exposures or just genetically are predisposed to not making enough blood-forming stem cells in a sustainable way. The reason that's an issue is people run into problems with infection, viral reactivation, increased susceptibility to COVID-19. They can transform to acute leukemia. So you can imagine in long-term spaceflight, what would happen if you had immune dysfunction? You could get a viral reactivation syndrome. So something that I have to handle in clinic in people whose immune systems are compromised because they have pre-leukemia, an aging hematopoietic system, a blood system, or because they've got leukemia, is activation of some viruses that are chronic. So they can activate CMV, cytomegalovirus, or more recently, I'm seeing JC virus, John Cunningham virus reactivation. The reason that matters is that affects your balance. It affects your cognitive function, your executive function. So you can imagine if somebody's out there on their way to Mars, their immune system isn't functioning, then they start to develop this balance and judgment issue. They will not be able to perform executive tasks, and they will not be able to coordinate some of their activities. That can reactivate in the time frame that it would take to get to Mars and back. So that's a concern to me. It's a concern as a stem cell biologist that stem cell aging potentially could accelerate in this environment because it may be that microgravity is not great for stem cells. So we plan to study that in the integrated space stem cell orbital research lab together with NASA and of course Space Tango. And we're starting other collaborations as well to do this.
That's fascinating. And I know we have limited time with you. So there was actually a follow-on question from the audience just before we get to Dr. Sawyer. And they were, someone in the audience was really fascinated to hear more about telomeres and their role in aging in space in low Earth orbit. So they kind of wanted to know a little bit more about what went on in the twin study and what exactly telomeres mean. You kind of touched on it, but if you have anything to add, I think now would be the perfect time since we're talking about space and physiological changes.
So telomeres are at the ends of all of our chromosomes. And so they're the little caps that go on our chromosome ends to prevent the chromosomes from unraveling. And telomerase is the enzyme in our cells that allows us to keep those caps on our chromosomes. When it's activated too much for too long, it can be associated with induction of cancer. And that's been shown in the blood system, and it can lead to something called, it can lead to a bone marrow failure syndrome called myelodysplastic syndrome. And that means your immune system doesn't function properly and you can't make enough red blood cells, white blood cells, or the cells that clot our blood called platelets. So why is that important that there was evidence of telomerase activation in Scott Kelly? Knowing that's just one person, he lengthened his telomeres. It's because if you activate telomerase, that it lengthens our telomeres for too long, that can lead to precancer in the blood and ultimately to cancer, or your stem cells get stressed out, they get exhausted, they age too quickly, and then you can't regenerate your bone marrow. So either way, it's generally not good. So is it all bad? You know, is that something that's just going to be inevitable, or can we predict and prevent that? So there's actually a drug that inhibits too much telomerase activity that's in clinical trials right now called imetelstat, and that's made by a company called Geron. And that one is actually very interesting. It seems to reverse some of the premature aging we see in the bone marrow in aging syndromes like myelofibrosis and also myelodysplastic syndrome. So it may be that that would have utility in terms of a preemptive treatment for people before they go on these long missions. Of course, that's entirely speculative. But I think with everybody on this panel, we're really trying to predict and prevent problems for the heroic people, potentially you, Shauna, that go into space and teach us about these environments and discover new things. So I think we can help people in these longer term missions, but we can also help to understand these major problems on Earth.
Great, thank you so much for that excellent overview. Dr. Sawyer, do you want to add anything about, you know, the overall effects and even the challenges that affect us when we go into space and how distance affects that as well?
Yeah, and we, as I said, Trish works in partnership with NASA, and so the framework NASA is using at this time is to look at human systems hazards, and one being obviously altered gravity and the physiologic changes from that, which include balance disorders, fluid shifts, cardiovascular deconditioning, muscle atrophy, bone loss, and even genitourinary dysfunction. Distance from Earth is another one of the 5 main categories of human system hazards. And that is driving the need for us to move from what I call augmented to autonomous medical care. I can speak a little bit more about that when we talk more about specific space environments, but there will be a point at which we move out into the deep space arena where not only is the mission longer, so the physiologic changes will be occurring over a greater period of time, but also there's no opportunity for resupply, there's no opportunity to deorbit, and there will be asynchronous communication. So autonomous health and medical management are going to be critical. Another system hazard is the hostile closed environment. So this really lends itself to looking at the human in the context of their environment, so vehicle design. But some of the hazards are CO2 levels, toxic exposures, water, food limitations, dust, and was mentioned already, well stated, the immune system dysfunctions. And then the isolation and confinement can lead to behavioral aspects that can be quite deleterious, also upsetting circadian rhythms, creating sleep disorders, and altering team dynamics, not just individual function, and not just behavioral, but cognitive as well. And finally, it's a standalone system that gets talked about is the radiation in space. And as we go into deep space and we're looking at more radiation and also a different type of radiation, we're really concerned about the acute in-flight effects of radiation on the human systems and also the long-term cancer risk potential. So these are the way that NASA's categorizing things. And then of course there are massive charts of human risk based on condition and the red, yellow, green status of how well we've developed countermeasures to those, and also what level of risk do we associate with that, and also what level of incidence are we anticipating that those things might occur.
So that was an excellent overview, and I think what I'm getting from that is space is trying to kill us, and that we need to be prepared if we're heading off into this hostile environment. So we talked about the problem space. So I want to talk now a little bit about emerging technologies and categories of technologies that can help keep us safe in space. And so, Mike, obviously you're working in the immersive medical space, immersive technology space. So talk a little bit more about that and how that may help spaceflight. And then I want to open it up to the rest of the panel to talk about their perspectives on emerging technologies. Mike, over to you.
Thanks, Shauna. You know, I think as Ainur and Katrina alluded to, you know, this is a very dangerous environment that we're thinking of sending people into in deep space. You know, a lot of the problems that are associated with these deep space missions really focus on low resource. So, you know, we have a very limited set of resources that we can send on a deep space mission, which I think actually it contributes to why we think about space as an analog for for Earth, because on these deep space missions, we have very limited resources, and in many places around the world, we have very limited resources. So I think the technologies that we talk about right now, they have application in space, absolutely, but this is where we call our spin out technologies and our spin in technologies. You know, we're spinning in currently our virtual technologies into space medical training in space, but we can also apply these same principles to, you know, low resource economies, for example, around the world. So getting past that, the actual technologies, you know, we are going to need, as Ainur suggested, more autonomous ways of providing medicine in space and deep space. So to do that, we need decision support systems. So we need some way to be able to understand what's happening within the spacecraft, what's happening with the astronauts. So we need to monitor the astronauts as well. So there's a full array of biometric sensors that need to be developed as well. So once that data goes to a decision support system, and that could be something based around machine learning and artificial intelligence, we still need someone to provide that healthcare. So for immersive technologies, we can use, you know, virtual reality to train the astronauts and to ensure that they upkeep their clinical skills as they continue on these long journeys, but also, you know, what happens in an emergency situation if your crew medical officer is injured? How do we then ask the rest of the crew to provide health care? And so we can use augmented reality, for example, which provides a digital overlay over the real world. We can use that technology to guide, you know, another astronaut in how to care for you know, the injured crew member. So these are really the types of technologies that I think, you know, we're developing right now, and will be implemented in these long-term space missions. But outside of, you know, the biosensors, the artificial intelligence, decision support systems, the training and procedural guidance systems, we also need you know, new technologies for example, portable ultrasound or MRIs to be able to actually assess you know, the patients. So there are lots and lots and lots of these very interesting new technologies that are going to be applied in deep space missions, and all of them have applications in terrestrial medicine.
Thank you so much for that, Mike. Yvette, I do want to hear your perspective. I know we have dwindling time left with Dr. Jameson. So quickly, before you have to go, Kat, if you wouldn't mind commenting on some of the opportunities in the regenerative medicine and stem cell space, if you have the time.
Of course, yeah. As the director of the Sanford Stem Cell Clinical Center, we're very interested in translating discoveries that have to do with stem cell research to the clinic. So we have active clinical trials where we have stem cell gene therapy, where we've gene corrected that stem cell that will grow up to be blood-forming stem cells. And that has many applications. Even without gene correction, stem cells can enhance repair and regeneration of a tissue. In the case of spinal cord injury, neurodegenerative disorders like Parkinson's disease, and then we can target what are called cancer stem cells. And the bottleneck there for cellular therapies that involve stem cells is expanding those stem cells and having them develop into the type of tissue you want them to develop into. And so it could be that the low Earth orbit or microgravity environment may help to expand stem cell populations. And that's a big bottleneck for us on Earth, understanding how to expand stem cells so we just have more of these rare cells where we can introduce the gene of interest. So for example, we have a clinical trial for a disease called hereditary cystinosis with Ted Ball and Stephanie Cherky, that patients have a problem with a gene that needs to be introduced into blood-forming stem cells, and we just don't have enough of those cells. So we really want to know how to expand those stem cells. So this works every single time. So that's a hopeful population with an inherited disorder that's almost uniformly lethal by the age of 30. So that's, you know, stem cell gene therapy for sickle cell anemia, beta thalassemia, all these inherited disorders is becoming more common, but we've still got this bottleneck of understanding how stem cells expand to see if we can do that more. The other technologies for drug development, which I've done a little bit of since I was in grad school, my PhD became a drug called Visudyne. That was for macular degeneration. That was a difficult to produce molecule and difficult in terms of production of this macrocyclic molecule. So sometimes when you make those drugs, we have difficulty with ring closure. So one thing that may work better on orbit is flow chemistry. So flow chemistry may help us to make these slightly larger molecules that have activity, whether it's for macular degeneration or in the case of cancer stem cell targeting to target the spliceosome or these editing enzymes that I referred to. The other thing that may work better in microgravity is X-ray crystallography. So we have some proteins that are difficult to purify on Earth. They like to stick to each other. And we're starting a collaboration with Axiom Space to see if we can crystallize a protein that's one of those editing enzymes that can introduce mutations into our RNA, and then we hope to go on to do that into DNA. So that specific environment may be able to allow us to expand stem cells over the short term and develop either the active product ingredient or the nucleated crystal structure more readily that will allow us to determine how to drug certain proteins that are absolutely vital for stem cell regeneration.
That's, you know, there's so much there that I do want to ask you about, but I do want to be mindful of the time because in very on-brand fashion, you're going to go from talking about stem cell therapies to applying them. So thank you so much for your time today, Dr. Jameson.
Well, it's really a thrill to be on this. Thanks. And I hope that we do this again and that we can all collaborate in this very unique environment.
Absolutely. Before you go, is there anywhere that if anyone wanted to find you or find out more about your research that they should look online?
Yeah, so I'm available by email, cjameson@UC San Diego, or so cjameson@health.ucsd.edu. We also have the Sanford Stem Cell Clinical Center website. And then I'm the Deputy Director of the Moores, M-O-O-R-E-S Cancer Center. So I'm available on all three websites. And perhaps you can post them at the end of the day, or at the end of the session, if you don't mind. But I'm always available and very interested in collaborating and building on the knowledge that will be gathered by this team.
Perfect. Thanks so much. Have a great day in clinic.
I appreciate it. Have a great day.
All right. So Yvette, I know that you must be bursting with to share your multiple experiences. You have such an amazing perspective. You have worked in the field. You have worked in some of the most austere environments the planet has to see, and you also have the luxury of knowing what the challenges of the space flight sector. So with that said, you know, have any technologies either spin off or spin in leapt out to you during your experiences? Do you want to talk a little bit about that? And then we can kind of open it up to talking about the realities of tech deployment. But
Sure. Can you hear me better now?
Yeah, that's way better. That's awesome.
Much better. Okay. You won't want to know the sides of the microphone I was trying to use. So I have to say, I think about what Einar mentioned was the integration, understanding that the physiological comes with the anthropological, the biological, and we think about the physical, all of it. I mean, we constantly have to think about what are all the causal factors attributed to our microbiome and our human experience. And so in all the testing that I'm doing now with the Institute, with the International Institute for Astronautical Sciences, I am focusing with Dr. Pandya on bioastronautic testing of strenuous environments and what is it that we're learning within microgravity, within very extreme environments and under testing, stringent testing to get experiments through a test readiness level progress. And it is a question about what do we recognize in our everyday lives that has been a spin-off? And I think we take sometimes for granted, or maybe we just don't know, that a lot of the spin-offs are like your shelf food. You look in your kitchen, and the Apollo program really lent itself to the food industry and how that developed. There was a huge impact on how we eat food now, how we can food. And in fact, that continues. There's still a lot of research that's continuing to say, well, deep space, we still need to have longer term solutions for projecting how long food can be stable in a deep space environment. That's something that I think we think every day we just grab and we eat, but it's a direct effect on our health daily. Botulism was a huge problem. We look at prosthetics and human-like robotics that changed the lives of so many people who were affected by, here on Earth, by landmines, by the consequences and being collateral of war and conflict. And how was that being tested in space, and how will that help us if in fact we have to face that reality on Mars, on the moon, in orbit, in a deep space mission. And these are realities of spin-offs that we already have in hand and are tangible, but we are definitely in a point where, like Mike mentioned, the technology that we have now with AI, so the artificial intelligence, machine learning, and even with additive manufacturing is blowing our mind, because it's the way in which we rethink how space has attributed to our health. How do we do remote controlled drug delivery? How do we look at the radiation protection? I've been very fascinated by the Israeli-US vest. I think it's the AstroRad vest that is going to be on the ISS deployed soon to test this radiation protection on the body. And I think at IAC, we were able to test that in person and really wear it and see what kind of technology is developed to protect the body. Additive manufacturing, I think, is really fascinating because I am not a data scientist. Mike, when you talk, I am fascinated by, and I experience AR and virtual reality when we do our flights, our microgravity flights, where we put these on to see, can we determine that I am a productive member of a space flight, a crew, while I'm wearing these augmented glasses, and can I follow lists and look at the screen while being interactive and actually a productive member of a team. And that is a very important approach to testing, because sometimes it isn't easy. And that technology, as it progresses, will help us when we're in deep space. And I can see the value of having a hands-free way to do technical approach to engineering, medicine, that we aren't able to normally. So I'm very fascinated by how technology is advancing just in the last 5 years, and how we can support that advancement in the years to come, and a lot of investment in research, accelerated research, and what other private-public partnerships we need to do that.
Thank you so much for that, Yvette. That was awesome to hear. So we have covered a huge spectrum of technology, from regenerative medicine, drug development, immersive medicine, AI, additive manufacturing, prosthesis, biometrics, food storage. But I'm sure this is only the tip of the iceberg. And Einar, the reason I saved you for last is because I know you have that bird's eye view with your position. What other emerging technologies can help us for space, and especially long duration and exploration class missions?
I think the main thing to think about is that shift from augmented to autonomous healthcare, where we need to build a precision space health continuum so that we can actually understand the optimal state of health and wellness and performance, and then pick up on early deflections from that, which requires an integrated suite of sensors of the human and their environment, and an intelligence system layered on that, so we can detect, and then we can understand, and then we can give an actionable insight back and correct, whether it's simple hydration, fatigue, nutrition, stress, but pick up a deflection on that from their optimal baseline, give an informational piece of actionable insight back so that they can correct that before they keep going down the clinical pathway. Once in a clinical pathway, though, we need to have point of care diagnostics so we can detect early and accurately what's happening. And then with the clinical decision support tools that Mike referenced, we can get to a treatment plan, monitor that treatment plan, eventually see recovery, and get them back through a rehabilitative process back up to the top, where is their optimal performance and health and well-being state. So that precision space health continuum, it's the same thing we're looking for on Earth. You can imagine that precision health continuum in a terrestrial environment would also be the ultimate of what we're looking for, getting us to truly informed health and health care so that we get the right information at the right moment to make the right choice. Hopefully that delivers the right outcome. So delivering those concepts or delivering on those concepts, as I said earlier, the space environment's a forcing function for that, but all of that will benefit us on Earth. I think of some of the other specific types of things, particularly when I think about Trish and Trish's agenda of funding early stage research and late stage technologies. So at both ends of that CRL, TRL development spectrum, some things are actually super early, like organ on a chip. And there are organ on a chip technologies and studies going on around radiation and other types of exposures. But there are things on the nutrition side of things, such as in the system biology world of using lettuce to actually generate parathyroid hormone, or PTH, which is a treatment to mitigate against bone loss and fracture prevention and facilitates fracture healing. But also looking at all the way from nanosensors across to AI, and that includes the hardware and the software components of that. Trish is funding projects across all of those things. And it's not just Trish, but we collaborate with other funding agencies as well to help us continue to drive forward those new types of ideas, if it's early stage research, and new types of technologies or new applications of existing technologies. But a really good point was brought up earlier about needing better validation processes for that. So not just more analogs, but ways to facilitate and accelerate the validation of these ideas across the arc of development. And I do want to give a shout out to the immersive technologies in terms of creating truly virtual simulating capabilities, which can be extraordinarily cost and time saving. So that's one example of an accelerated validation model. I think there are many, many technologies we can talk about. I'm very excited about the technologies that have been translated back to Earth, and I'm happy to have a deeper dive on that. But I think one of the things we have to get across is that whether you're doing basic science or you're doing really end stage translational product development, there is a role for you in solving problems in the space environment. And the reason I'm honing in on it right now is I want people to understand that it isn't a distraction from what you're doing. It can actually be a platform to accelerate what you're doing and accelerate you to the next milestone. And it's important to be able to articulate that to investors as well, that it doesn't need to be a mission creep or whatever, scope creep or any of those things. It can be perfectly aligned with commercial success, and in fact can accelerate it. In the research end of things, Kat mentioned that there are certain research projects that actually are accelerated by being in the microgravity environment. She mentioned some really good ones. Even if you're not building a solution for space, you're building it for Earth, you can accelerate that work by being in microgravity. A good example is Tammy Chang's work on building liver organoids, 3D structures of synthetic organs that she's working on. So I think it's very important for us to understand the benefits of having that venue for validation and acceleration of research, but also the ability to accelerate components that we're going to use in that environment by creating new models of validation.
There are just so many quotables there. And I think the thing that you said that blew my mind the most was talking about lettuce and parathyroid hormone delivery. And I never would have thought that salad could be hormone replacement therapy. So that's amazing. Before we move on from this topic, you know, I think it was you, Einar, who alluded to thinking of space as an analog for Earth. And I think that's really powerful because I certainly haven't thought about it that way. So kind of to open up that discussion, and Yvette, you kind of alluded to this with, you know, the need to develop better food storage strategies in the field. What technologies, what practices, what processes on Earth do we do really well, or should we be developing to adapt for space flight? Yvette, I'll start with you and then we can go around.
This is a hard question because I feel my go-to is immediately what I'm focused on, which is analogs that are actually taking place on Earth, right? And there's so many now. The growing number is quite impressive. And I look at IIAS itself is an analog, an extended analog that we do in cohorts, but we have high seas, MDRS, literal habitats that we're learning, Biosphere 2, the Arctic, Antarctic, and I think a lot of the technology coming out of these environments have had profound impact on the life support system, the closed loop systems for the ISS, thinking about how do we create an environment that's safe, that's long-term, and how do we power that? I think we forget also that those, again, the integration of other technologies is really important. And we test those on Earth. And it's really, I think, testing kind of the limits of creativity and innovation to say, not always do we have access to microgravity here to test as a test bed. So there's very few and rare moments, like IIS does have that capability in Ottawa. And when you have that rare ability to be on a test environment in microgravity on Earth, you know, and being able to test it here, those are the markers for, can we have high fidelity analogs? And can we really identify on Earth those high fidelity areas where we can get enough TRL readiness for ISS approval, and is it justifiably needed? Is it a long-term solution? And that's why even when Arna says, you know, we have to have all of these high tech, high fidelity, and it has to be really important to understand what is the justification for investing in these. The commercial sector is open. There are so many people chomping at the bit to be part of it, to be a contributor, to be a participant. And now another challenge facing that entire industry is, how do we vet for integrity, credibility, and reproducibility of all of the science that's coming on? I think that's going to be very important for what goes in and is deployed.
That's perfect. And so kind of knowing all of that, Mike, knowing the challenges, what are your thoughts, particularly as it pertains to things you talked about, immersive medicine, immersive technologies, biometrics? You know, what are the opportunities from what we're seeing on Earth for application to spaceflight?
Well, I mean, I think they're across the board. With immersive technologies, as it's been alluded to, we can create very high fidelity analog environments, right? I mean, we can mimic the space environment in a headset. We can have collaborative environments as well. So it's not just that you put on a headset and you're alone in this environment. If we do want to study, for example, you know, mental health of astronauts as they're isolated for you know, some time in a small sort of contained environment, we can do all of that within a virtual headset now. You know, and so we could integrate into a single system, you know, a very analog environment. So you can integrate your biometric sensors and your immersive technologies, and really be able to study and validate in ways that we haven't been able to before. And so, you know, Shauna, we've talked about your gravity offset program here on Earth, and coupling, you know, virtual technologies with gravity offset to really give that feeling that you can be in that analog environment and simulate space. And so as we do that on Earth, then we can, you know, better train our astronauts before they you know, go into orbit. But then using the same technologies as we mentioned, you know, you can provide additional training as we go further into the cosmos. So I think you're muted, Sean.
It is, yeah. Technology. So I am going to open it up to Dr. Sawyer in a sec. I just want to do some quick translations because in the space world, we love our acronyms and we love our terminology. For those who may not be familiar, analog environments refer to any type of environment that is analogous to the spaceflight environment, that replicates some aspect of it, whether it's the isolation and confinement or whether that's the reduced gravity that you see on parabolic flight, which is a way of replicating zero gravity on Earth without going to space on an airplane by simply flying in a parabola. MDRS that Yvette had mentioned is the Mars Desert Research Station, and is real life on fake Mars is an example of one of these analog environments. And then finally, the gravity offset system that Mike alluded to, which is super exciting to some of us, that Yvette and I have had a chance to train on, and I'm sure that Einar is familiar with, is a way of putting yourself in a harness and offloading your weight to the point where you can replicate partial gravity like on the moon or Mars, or zero gravity like on the International Space Station. So that's your 10-second space translation from me, your moderator. Einar, any spaces, any technology spaces on Earth that particularly interest you as in your position with Trish, that you are, or Trish is looking to find more about? You mentioned point of care diagnostics, mental health was briefly alluded to. What are your thoughts?
Yeah, so we just completed a solicitation for industry directed at companies that had behavioral health solutions, but each season we put out more solicitations on focused topics. Right now, I think one of the things I'm most interested in is trying to create and build out that integrated suite of sensors that will, of course, be integrated with environment and the human, but integrated with smart layers so it becomes meaningful. So that health sense matrix, I've nicknamed it, to support a space health, a precision space health continuum. I think that to me is very important, and we're working on the components and the pieces of the puzzle that could fit together around that. I'm very interested also in the immersive technologies from a training standpoint, and also for developing adaptive medical procedures for space. And the simulated environment with the immersive technologies, of course, I work in orthopedic surgery, so we're looking at a lot of these. And I think they have training importance in preparation, so on Earth pre-mission, but also in mission, especially the long missions, you're going to need to have reinforcement modules that are as realistic but small as possible. And then you also need to have the real-time guidance that the immersive environment can support. I think that we also need to be thinking about, in every one of these technologies, how space can force upon us to solve things that we need to solve for Earth. So how can we develop things for resource-constrained environments? And the trade space analysis process that NASA does is absolutely essential and a forcing function for us to get at better healthcare technologies for Earth. So we have to evaluate over and over, how do we trade out volume, space, cost, power, miniaturization, interoperator usability, but holding ourselves, whether we're developing technology for Earth or space, to those standards in that trade space analysis is going to help us develop technologies for Earth in really resource-constrained environments. And I think that's why we see the relationship and the bidirectionality of these fields.
That's perfect, and that segues into my second to last question. The hour goes super fast, so we have about 10 minutes left. So the two questions I want to spend our time on are pitfalls, realities, and the regulatory space. And then it wouldn't be a panel in 2020 without talking about COVID. So the first question I want to ask, starting with Mike, is what are the pitfalls of trying to adapt a technology for Earth and then adapting it to space versus the other? What are you running to from a regulatory and investment standpoint? So let's start there, and then we'll do the round table.
Yeah, so adapting technologies for space, you know, technology suffers from a lot of the same problems that people do. So, for example, radiation is a big issue for electronics. So whenever we send a piece of technology to the ISS, it has to be radiation hardened, for example. Now there are different ways to do that. So for example, HP Enterprise is putting up spaceborne, they put up the spaceborne computer on the ISS several years ago, and they used what they called software hardening as opposed to physically hardening the device to block radiation. You know, so those type of issues we have to consider. Simple things that you may not even think of. A type of plastic can off gas and create sort of toxic gas in an environment, and especially in an enclosed environment like a spacecraft. So we have to make sure that, you know, we are looking at all components of technology when we're getting it ready for space travel. Those are some of the hurdles, but for immersive technology, especially, you know, how does it actually behave in zero gravity, and how do we test that? You know, are the sensors behaving the way that we want them to? You know, when we remove gravity from the equation, does the headset behave in the same way? And so we do that, you know, testing with analog missions, but ultimately, you know, we may have to custom build sensors, custom build headsets for the space environment. You know, those are the type of pitfalls, but I think those are the same for any type of technology. You know, you mentioned the investment environment, and I think, you know, that as Ainur suggested earlier, I think the critical piece for investors in this space is to understand that ultimately this is not a distraction. As Ainur said, this is a proving ground, and if you can build something for space, we can drop that same you know, piece of technology into a low resource economy. And you know, our long-term goal is to put a medical school in a headset like this, right? So if you think about the possibilities for training in low resource or middle income society, or you know, economies, it really opens up the possibility of a huge market, and we're proving that with our space-based technology. But it's you know, from an investment standpoint, I would say don't shy away from space tech companies or companies that are in space, because we're all looking at obviously terrestrial applications for our technologies.
Great. Yvette, I'm going to throw it over to you and then to Ainur before we move on. So what are your thoughts on kind of the regulatory framework, or even like hurdles with technology deployment?
I actually think it's interesting and a good question, because there's certain things in the industry and across maybe many industries that make you shy away or have a thick barrier on them for scientists, for researchers, for engineers. And it's really important to find those people who are in love with regulatory frameworks, because in fact, when you peel back the onion, and I'm one of those rare ones who I understand, appreciate, and I don't mind the checkbox list of a regulatory framework that's helping me to really challenge the best of my science, the best of my research, to really push the boundaries of what my team can do. And if we can do it within those regulatory frameworks, we are all accountable for the outcome. We're accountable for how well the technology works. We're accountable for how well it's going to save lives, how it's going to impact communities on Earth. And I don't mind being part of that. And there are a select and unique personalities across the industry who like the business development approaches and do make sure that your test readiness levels, your TRRs, fit within that. And as long as you have somebody always on your team, or if you can adopt behaviors, we can't underestimate that we can all adopt a behavior to appreciate and learn from that process. So I don't mind having that. I don't see it as a hurdle. I actually like to question those frameworks and add to them. So I think that can help us to be better researchers, better scientists, and then make us go further.
I saw Mike nod emphatically because lots of stories about regulatory frameworks. We're short on time, so Ainur, I'll pass it over to you.
Well, I think it's important, incredibly important. The regulatory frameworks, could they be improved upon so they're less obstructive and more facilitated? Yes, and I think that work is underway. But they're incredibly important because they impose something that's necessary, which is an evidence-based approach to solution development. And it starts with an evidence-based understanding of the problem to begin with. So I really encourage people to understand the importance of evidence and building evidence from the minute you step to the whiteboard and start sketching out an idea. You should start building your evidence development plan. So your research plan needs to start the minute you're whipping out an idea and starting to brainstorm on that. I think that one of the challenges is that people don't understand how much groundwork has already been laid by research in space and space medicine, and they hear of a problem and they want to jump quickly with an idea, but it's very important to do the homework and understand the problem at a deep level and the tremendous amount of evidence and that's already been collected and stored somewhere in NASA, which is not easily searchable, but it's public information. So please do the homework and understand the problem and what other solutions have already been proposed before you bring your idea forward. I think that's a very solid way to start. And then I just want to say also to investors, again, if there are any listening, that evidence isn't a distraction and it doesn't slow you down. It should be built into the timeline of milestones. One of the sad things I see is when investors come in, there could be an evidence-based solution being developed, but when they get that investment and they impose milestones that have to do with commercialization, in healthcare, it should be a 2-year runway. It's not software. It's not a 6-month runway to commercialization. What happens is the science team gets fired and the sales team gets hired. And that is a really painful thing for me to watch in technologies that started as an evidence-based mission. And I'm preaching to the converted here, but if we could somehow get people to understand that evidence isn't just a good business model, it's the only successful business model. Because if you come to me on my procurement hat in a healthcare system with a technology that doesn't have an evidence base or validation, you might get an early pilot in a small community hospital, but you will not get traction at an enterprise level.
That's perfect.
Absolutely, yeah, 100% agree with that sentiment. I mean, the reality is that medicine is regulated, and I have colleagues and I've heard horror stories of, software companies that are trying to develop a medical application, and they go through and they develop it without generating any evidence, without even thinking about it, because, hey, I'm just going to be selling this to consumers. But if it's a medically related application, more than likely it will be regulated, and you are going to waste a lot of time and effort and get to the final point and not be able to sell your product because you realize that you haven't generated any of the evidence that you need to support it. So I'm 100% agreement on that, Ainur.
And we all want to have impact. I mean, if you're putting energy into anything you do, I think every single person wants it to have impact. It's the so what factor of all that we're doing. And you need to keep proving every step of the way that you're going to be able to create impact with it on a very human level, aside from the business model.
This has been a fantastic conversation, and I can't believe we're already out of time. There's so much more that I wanted to touch upon, COVID included, but I guess that just paves the way for round 2 if everyone's up for it. So we talked about everything from the regulatory framework to the challenges of the spaceflight environment to the whole gamut of technologies, from regenerative medicine to immersive technology to food storage to additive manufacturing. So just in closing, I'm sure there's so much more our audience wants to know. So maybe we'll do a quick 30-second closing thoughts, and then where the audience can find out more about you and your work in particular. We'll start with Yvette, then go to Ainur, and close with Mike.
Thank you for this. I learned a lot today. You can find out more about the International Institute for Astronautical Sciences by going to astronauticinstitute.org. We do have open courses and anyone can join. We do have an ongoing campaign for microgravity, and so you can check out all our information on our website.
Perfect. Ainur, over to you.
Oh, thank you. I have really enjoyed this and also learned a lot and met people that I just started the conversation with, and I will connect with you. Please reach out to me whether you're interested in the UC Space Health Program, and we are always interested in collaborating, or Trish. And for Trish, I really want to say that we do funding, we do a lot of support, we also do training, a lot of educational programs, and we support trainees in building up the next workforce. The funding is non-dilutional, take no equity, no IP. Has to be US-based company or a company that's international with a US LLC or a US PI collaborator. So there are many ways to do it as internationals, and we definitely welcome that. So please reach out. It's einor.sawyer@ucsf.edu, and the Trish website is at Baylor School of Medicine.
Perfect. Mike, over to you.
So thank you very much for the invite and for the opportunity to talk about our technologies. I've learned so much as well. This has been a fantastic panel, and I'm looking forward to, I would love to collaborate, you know, on a variety of areas. You can find us on the web at luxonic.ca, luxsonic.ca. And you can find me on LinkedIn. I'm most active there. So if you just look for Mike Wesolowski and Luxonic, you'll be able to find me there. So fantastic panel. Thank you again so much. This was an absolute pleasure.
Thank you all for attending. And last but not least, I'm going to turn it over to Craig, one of our session supports, to close it out. Thanks again, everyone.
Thank you, Shauna.
Thank you.
Thank you very much, Dr. Pandya, and all of our panelists for your time today and for initiating this critical conversation. It sounds like there's plenty of material for a follow-up. And thank you so much for your patience as we work through the technical difficulties this morning. The entire discussion will be available on demand later today. And up next, we'll learn from the personal journeys of two luminary space entrepreneurs, Jason Andrews and Tabor McCullum, starting at 12:15 p.m. Eastern time. So please stay tuned, and I hope everyone has a great day. Thanks very much.